So good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar. The ESRD NCC Webinar events are held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patient and professional subject matter experts from around the country, sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID Webinar webpage. Let's take a look at the agenda for today's call. Today we have two speakers. First, Dr. Dale Lupu is Associate Research Professor at George Washington University, where her current research is in integrating palliative care into nephrology care. She has 40 years experience in hospice and palliative care. Her conviction is that the end of the story matters. Also joining us is Dr. Elizabeth Anderson, who is an Assistant Professor of Social Work at Western Carolina University. She practiced as a hospice and palliative care social worker, bereavement coordinator, and social services director for Mid-Atlantic Renal Coalition. One of her research projects is exploring best practices to engage family members of patients with kidney disease in rural communities. They will be discussing our topic of maintaining emotional balance in an unbalancing time. Our panelists go through their, as our panelists go through their presentation, you will have questions. Please submit them using the chat feature through WebEx or the Q&A on the lower right side of your screen. When we get to the question and answer section of the presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. So what this call is about: you will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of calls is available to you weekly, offering a variety of topics. I will now turn the call over to Drs. Lupu and Anderson. Welcome, ladies.
Thank you. We are excited to be invited to this. Can you all hear me? Can I get a nod, maybe, Dale? Yes, okay. So I'm Liz Anderson. The other person you can see is Dale. So thank you, Jerome, for those great introductions. We have been spending a lot of time over the last couple of months hearing stories from patients and family members, dialysis facility staff, and even our own lives, our own people, about how living in a pandemic is so difficult and so stressful. And so we imagine that that has also been the case for you all as dialysis patients as well. So one of the things that we thought would be important to share that we want to talk about today is how to help restore emotional balance during these really difficult and uncertain times. And in order to do that, we really want to spend a little bit of time talking about resiliency. So resiliency is this idea that when life happens, we know that life is going to bring us good things and bad things, right? That there's going to be a wave of good things and bad things. And most of the time when we're in that wave, if something bad happens, we feel some negative feelings. We feel anxious or sad or angry, but we generally can move out of that. And we call that our resiliency zone. But when something really big happens, like a crisis or a trauma, or even if just every single day you have to deal with negative news after negative news after negative news, it can be hard for us to get back into that resiliency zone. We can lose track of our ability to kind of find that stabilization again. So when we're healthy and we're in a resiliency zone, if we get a speeding ticket on the way to work, or if we get in an argument with a loved one, we're going to feel bad for a few hours, maybe a day, but we can bounce out of it. But when we go through something like this, that sometimes we find that we're way out of our zone, and it's really hard to get back to that resiliency place. And so that's why we're here today, is we want to talk about how to do that. The first thing that we want you all to think about, or we want you to hear from us, is that you are resilient. And by virtue of the fact that you are a dialysis patient and you have showed up for this webinar, or you're listening to the recording, then you clearly already have a skill set that you know how to cope. And people that have been through so many healthcare experiences, as I imagine many of you have, you've already built some resiliency tools of your own, and we're going to help you today think about those that you already have that are unique to you, and we're going to give you some extra tools to build on. So with that being said, I'm going to turn it over to Dale.
Thank you, Liz. Yes, so we wanted, there are many things we all can do to get back to that resiliency zone. I'm going to tell you a little story. It's a little silly, but it's about myself. So you heard in the introduction, I'm a public health researcher. I like numbers. I like spreadsheets. So on March 26th, when we started this shelter at home where I live in the Washington, D.C. area, I started a spreadsheet. And I put in the numbers each day of how many new cases there were and how many people had died. And I started making my own projections and comparing it to other researchers' projections. And that was all well and good. I've set up the spreadsheet. A week into it, I'm checking my spreadsheet every day or two. 3 weeks into it, I suddenly begin to see I'm checking my spreadsheet like 4 and 5 times a day. And I notice kind of a deep tension in my stomach every time I go to it. Like, what are the new numbers? Are there new numbers? And I realized that I was anxious and that I was putting a lot of anxiety into a kind of ritual of trying to, maybe if I could make some projections, I could somehow get control over this uncontrollable thing. So I took a breath and I talked to my husband about my silly spreadsheet obsession, and I named that it was anxiety. And then I took another breath and remembered what are some of the things that I like to do to calm down, and one of them is talk to my kids, my adult kids, and had a call with my daughter. And then the final thing that I did was I decided I'm only going to work on this spreadsheet once a day at 4 o'clock. And I pretty much have been able to keep to that. So if you see on this slide, you might be able to hear the things that I did. I connected with someone about this thing that was making me upset, but it doesn't have to be about it. It can just be just talking to someone. I named the emotion. I thought about what has helped me be resilient in the past. Oh yeah, also I would admit I'm listening to Harry Potter books again. And I created a routine around this particular piece, and that routine has really helped me manage it. So Liz, let's go back to you. The next slide. Will you talk to us more about anxiety? And Liz, you're on mute. You have to come off mute.
Right, that helps. Thank you. So just as Dale said, I think one of the important pieces of this is recognizing our own emotional reaction when we're going through really crazy times like this. So I think one thing you have to remember is that we are all born into this world with a variety of emotions. Everybody is. And because emotions serve purpose, even anxiety serves purpose. But when we have too much of those, it can actually cause problems to our relationships, can cause problems to our health, etc. And one of the emotions, we're going to talk about anxiety right now, but you could really substitute this for other emotions that you may be feeling, which might be sadness or grief, frustration, restlessness, etc. But anyway, anxiety, that's what we picked it because we're hearing over and over again that is the emotion that patients, caregivers, ourselves, we're experiencing. And a lot of times I think that it's hard for us to recognize that we might be feeling a negative emotion, that sometimes even I, as a social worker, am like, oh, no, that's a sign of weakness. I'm not weak. I got this. I'm a social worker. I know how to deal with it. But the truth is, if I really want it to go away, I got to name it and know it. So how do we know that we're feeling anxious? That sometimes we have to look for clues. So one of the things that we're hearing in news reports all over the place is that people are having a lot of trouble sleeping. You know, that they're maybe having trouble falling asleep. They're waking up in the middle of the night. They can't go back to sleep. People having nightmares. I've had nightmares that I'm out in public. I didn't know that it was COVID, but it was. And so when we're having trouble sleeping, when something like this is going on, it is a sign that we're feeling anxious, because it means that our body is processing all of this even when we sleep, right? So that can be a clue. Another clue that we might be feeling anxious or feeling really down is that we might have these negative obsessive thoughts. So Dale talked a little bit about her obsessive thoughts about, you know, the spreadsheet. I sometimes have these obsessive thoughts like, oh my gosh, I don't know if I can get through this anymore. If I can't get out of this house today, if I got to see these 4 people one more time. If I'm having these thoughts that are just negative after negative after negative, usually that's a cue to me, I'm feeling anxious or I'm feeling down, right? So really paying attention to those things is part of that battle, I think. And I've listed a few other things, symptoms here as well, I think you all are familiar with. So we're going to talk about some intervention. So what do you do? How do you help yourself in the moment? And so I think we got to think about this 2 different ways. There are skills that you can do when you're in a crisis, and there are things that you can do to prevent yourself from getting in a crisis, right, from escalating. And these are really kind of both. So one of them is really limiting your news and social media. Find 1 or 2 sources that you really like and commit to those 1 or 2 times a day for, you know, it says 1 to 20 minutes. I think I might have meant 10 to 20 minutes, but 1 minute is also okay. But limiting that negative news. Also, you know, paying attention to what you put in your body that's making you feel bad. One of the things that I've learned through this process is I don't really need to feel more anxious with another cup of coffee in the afternoon. I need to cut that off. But a lot of times we think those things are going to make us feel better in the moment, but then the next day they actually make us feel worse. So paying attention to that. Exercise, tons of studies indicate that if we can even if it's walking a circle around the outside of your house, your neighborhood, that those, when we exercise, it creates a lot of the same positive emotions that medicines can create too. Keeping the news out before bedtime, like Dale mentioned, getting on the phone with a friend, and establishing a routine. So, you know, a few weeks into this, I ended up having to say to myself, okay, Liz, you're going to get up at the exact same time, 5 days a week, like you were going to work. You're going to work out. You're going to take a shower. You're going to get dressed, even though you're at home in front of a computer. So figuring out what that routine is for you as well. Back to you, Dale.
So we want to talk about 2 steps when you are in the grip of a deep emotion, an emotion like anxiety or sadness that really feels like it's going to overwhelm you and knock you out of balance. So there are 2 steps to this approach, and this grounding technique you see on the slide we'll talk about in a minute. But the 2 steps are, 1, to name the emotion. And I would say name it and watch it, almost like it's on a video screen. You know, sort of watch it. You're saying, oh, I'm anxious. And then you'll start to see it change a little, like, oh, wow, I'm not just anxious, I'm mad. I'm mad that I'm in this situation. And then that can change a little. I'm not just mad, I'm really sad. You know, so seeing it, naming those emotions as they go through you helps them feel not so solid and helps you feel like you have a witness that can watch the emotion rather than you are completely drowning in the emotion. So that's step 1, is name it. And step 2 is to ground and really observe it in your body. So again, when I talked about noticing that I was anxious in my spreadsheet, I noticed this feeling in the pit of my stomach. So really noticing where do you feel anger in your body. I'm getting hot, you know, I'm so angry, I'm hot with anger. Or sadness, I feel a lump in my throat. Noticing where it is in your body, it's surprising. We think that if we don't pay attention to the emotion, it will go away, but it actually works the other way. If you can pay very close attention to how it's moving, exactly what it feels like, not the thoughts, but what it feels like in your body, that really helps manage it. And so this technique in particular is a grounding technique. Liz, can you just take us quickly through it? We won't do it, but you want to just talk it through?
So if you're, the idea here is that anxiety, which we just talked about, is actually our brain thinking way in the future. And we're the only species that can think in the future. And that's why we get ulcers, because we can worry, right? And grounding techniques help reorient us to the present, because when we're in the present, you know, unless a tiger is chasing us, we're probably not going to feel anxious. And so this is a tool, and there are lots of other tools, and Dale can speak about some other tools too, that really are about helping move us away from thinking about the future to right now. And so it's kind of meditative, but really walking yourself through, you know, slow down, let me think. What are 5 things that I see around me, 4 things that I hear, 3 things that I smell, 2 things that I feel, 1 thing that I taste. So it sounds kind of silly, but what it does is it changes the way that we're thinking to the here and now, which generally in 20 seconds or so can reground us. So that's just one example of a tool you can use, and we've also posted a video on the slides that you can look at to find some other relaxation techniques.
Next slide, please.
So the last technique we wanted to talk about is really accumulating all of this together, and that is assertive communication. And so we can't really expect for things to change if we also can't articulate our needs. And so the first part, like Dale said, is learning to be able to identify that emotional piece and then be able to articulate to people how whatever that is happening and what we need. So if you look at this graph here, it's really a guide to show how to use I statements. This is how I feel when this happens in this situation, and this is what I would like. So assertive communication has really 3 components. This is how I feel, this is what, when it happens, and this is what I want to happen. So we've given some just kind of concrete examples of how COVID specific that you might be experiencing in a dialysis unit. But another example would be for if you were feeling really sad or down or depressed. Because one of the things we know right now is that people are actually experiencing a great deal of grief. Even though you might not know someone that has died, you can have grief from not being able to use your favorite coping skill of going to the movies anymore, not being able to see the people that you love anymore, not being able to be more than 6 feet away from, you know, your caregiver, et cetera. So we have lots of losses that can make us feel that way. And sometimes it feels kind of weird, like, how am I going to tell somebody that I feel down? And I say, it doesn't have to be weird. If somebody says how you're doing, being able to articulate, you know, I'm feeling kind of blue lately. All this negative news, I can't see my grandkids, you know, everybody in dialysis is wearing their PPE. I'm worried about the future. So that's your first 3 columns here. Here's the problem. I feel this way when all of this happens. And I need to find a way to get my energy back. I need to find a way to get my mood back. That's the assertive statement. So you're putting out there, this is how I feel, but this is what I need. And I think it's important because in all of the years that I've worked with families and been a family member myself, I've come to learn that the people we love are not psychics, and they don't know all the time what we need. And so it really becomes important in these times when our loved ones might also be feeling the impacts of this, that we can clearly communicate. And that we can clearly communicate with the staff that we work with as well, because they're there and they want to help us too. So this is just a a guide for how to get that started, how to be able to communicate those things. So in conclusion, we want you to know that if you are feeling emotional unrest right now, you are definitely not alone. We are feeling that, we're seeing that from other people, but we also want you to know that you're not destined to feel that way forever, and you have already demonstrated resiliency in your life. You've already shown up for this, you've already been through many battles, and you can really draw on some of those skills that you've already learned during times like this. Likewise, this is a time where you can build your resiliency as well. Use this experience to allow new ways of learning how to deal with things by articulating those emotional responses, helping reorient yourself to the present through using different techniques, and learning how to articulate your needs to people that you love and care about. We could say a whole bunch more, but we wanted to leave some time for you all to ask us some questions. So anything else you want to add, Dale?
I'm eager to hear what people would like us to comment on or their experiences. So let's open it to questions.
Yes, absolutely. Liz, Dale, thank you guys very much for a great presentation. If you would like to submit a question for Liz and Dale, please use the chat feature in WebEx or the question and answer feature in WebEx so that we can get those questions out to our presenters. We did have one question come in already, and it says, my dad is now scared about going to dialysis. He has little mobility, so can't really exercise. How can I help my father get over his fears of going to treatment?
Mm-hmm. Yeah.
You want me to do that?
I think the first thing is just acknowledging the fear, that it's not irrational for him to be afraid. So I think really the first step is to say, Dad, I can see what a scary situation this is. Liz, what would you do? What would you say next?
Yeah, I think I'd help unpack that a little bit and talk about, what specifically that he is afraid of. And I think also reminding people that, one, there are a lot of things to be scared of, but there are also a lot of things that are happening right now to protect people. And so reorienting people to these are the things that you're doing to protect yourself. So you're wearing a mask, you're whatever other precautions there are. This is what the dialysis facility is doing. So reorienting people to that. And then the other piece I think that is important is acknowledging that you can allow yourself to worry a certain amount of time, but we're all still living right now too. And we also need to find some joy in our life too. So when we're having that overwhelming anxiety, helping reorient people to what can bring them happiness and joy is going to be an important part. And then, at some point, being able to talk to people about what their long-term goals are and, going through some what-if situations and trying to unpack what his goals are, if they've changed, and learning about that and talking to somebody on the dialysis team about it.
Okay, good. So another question that we just got is, what recommendations do you have for dealing with feelings of isolation? I go to dialysis, but with COVID and stay-at-home orders, I still have a feeling of isolation.
Yeah, and you are way more isolated than anyone wants you to be or you want to be. I mean, so I would just say again, you feel isolated because you're probably way more isolated than you wanted to be. So just, it sounds simple, but again, just there it is. That is how you feel. And then there's moving on to strategies. So there's the strategies for dealing with the isolation. Take up learning a new language if you're able to use technology. Favorite books. One of the things that really works for me is a technique that I call to myself resting in beauty. So just looking at something beautiful, a picture, a flower, a stone that I happen to have on my bookshelf. There's something about appreciating beauty that's really helpful. But the isolation piece, to the extent, we don't know whether you have capacity to, do the internet. We're also Zoom exhausted, but it is lovely. I do enjoy seeing my far-flung family members, and that does help. Doesn't solve it. Liz, other thoughts?
Well, I think I agree that the internet has a great place for connection, and though it's not ideal, it's better than nothing. And so using that, and then I think going back to that assertive communication piece, I think you got to tell the people you love, like, I'm struggling. Not seeing everybody really has me in a funk, and I'm wondering if we can schedule a time every week, or I have a deal with my mom that she calls me once a day at a certain time, so whatever that is, but being able to articulate, I need that, I think is an important piece as well. So being able to ask for that. And then also, I'd ask the people in your dialysis facility too, if they have any ideas about how people like these can connect to other folks right now locally.
So I think we have time for one more question, and this person asks, how do you handle death of patients at this time, even if it's not from COVID in the dialysis unit?
So I wonder if this is a staff person asking or a patient asking, but this is one of
I believe it's a staff person, actually.
Yeah. Well, I think the first thing is to be tenderly honest with other patients that indeed the person who has been coming, people may have been coming together on the same shift for 5 years. So not trying to hide it. And we, in our Quick and Our Tomorrow with staff, will be talking about some ways that dialysis centers can kind of more publicly just acknowledge and have ceremony and have ritual around acknowledging the memories and legacy of patients who have died. Liz, you want to say more about?
Well, I think that one of the things that I've heard from patients my whole career is that they want to know and they want to talk about it. And, when my job is to help people heal, and I think part of healing is helping people talk about sometimes their difficult stories and holding a place for that. And, just that whole being present and being there and just sitting with it, knowing that you can't fix it, but that listening piece I think is really important. But as Dale said, yes, tomorrow we've got some more specific strategies as well.
Right, but just again, the kindness that people, if you are able to kindly say to someone, to another patient, I'm sorry to tell you this news, but Mrs. Smith, who you've been seeing, for 3 years, died yesterday in the hospital, and we miss her so much. We miss, if you can say their name, if you can say something about them, we miss the way she always used to bring us cookies when we could still do that, or, the way she always had that joke about Joe, that's a way to make that connection.
Well, Liz and Dale, thank you very much for the great conversation today. We really appreciate you joining us.
Thank you. We hope everybody can get into their resilient zone and be balanced.
Right, absolutely.
Okay.
Thank you.
So now we'd like to introduce a new resource from the ESRD NCC. It's called thekidneyhub.org. This great new resource we've been getting a lot of great reviews from patients about. It's secure, mobile-friendly, with input from patient volunteers. It contains information for patients and professionals. It has links to COVID-19 information, transplantation, home dialysis, infection prevention, and more. The goal of thekidneyhub.org is to help patients and family members make well-informed healthcare decisions. Our next patient webinar event is next Tuesday. However, Drs. Lupu and Anderson will join us tomorrow for the professional webinar call. Tomorrow's call will focus on how dialysis staff members can help patients maintain emotional well-being during the COVID-19 pandemic. And again, thank you all for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. You can also review additional COVID-19 tools at kidneycovidinfocenter.com. Thank you, everyone. Have a good evening.